Welcome everybody. This is our first dental public health webinar from the University of Leeds, and we're very pleased that you've been able to join us this afternoon. It's 1 o'clock in Leeds and the sun is shining, which is not unusual. Fingers crossed. Okay, so we're going to tell you a very little bit about the course as members of staff. This is Dr. Csikar. I'm Professor Gail Douglas. We're the course leaders here for the Dental Public Health Masters, and we teach you on the principles of dental public health and look after you for your research projects. So let's have a little look. First of all, I don't know where you're from, but we're going to find out in the poll. And I'm not sure if you know where Leeds is, but here's a map, and just here in the centre of the United Kingdom is a little red dot, and that is Leeds. So if you put a pin and try to spin the United Kingdom, that's where Leeds will be. It's a very beautiful city. We have lots of lovely shops, lots of lovely architecture, and we are so looking forward to welcoming you to Leeds. Now the students are going to tell you a lot more about the practical aspects and what life is like here in Leeds. First of all, so if you haven't already answered the poll on the bottom right hand of the screen, can you tell us with your voting buttons where you are from, and also what's your background? What is it that you've done before joining us here in Dental Public Health? Are you a dentist, a hygienist, or is your background something different? If you're having any difficulties, please type in the question box and we can try to help you too. We'll come back to that near the end. So, I'm going to introduce you now to the members of staff that teach you at the dental school for the dental public health aspects of the course. You can see here on screen there's a lovely picture of Julia, myself. As I mentioned, we lead the course. At the university we're also assisted by Professor Claire Hume. We're very privileged to have Claire Hume as part of the course teaching. She's an expert in health economics and has lots of experience within dentistry. We also have Karen Vinal, who is beneath me in the picture here. And Karen brings a background of health psychology. And again, we're very privileged to have that input. Julia, do you want to mention what your background is?
Yes, I not only work for the university, I also work for an organisation called Public Health England as a senior public health manager. And some of the passions that I are very interested in is health inequalities, smoking cessation, alcohol cessation, things like that. And I've got a wide sort of service industry background also.
And actually, that's one of the benefits of the course. I'm going to show you now some of the others teaching on the course. And they come from quite a vast array of backgrounds. So we've got Dr. Ronnie Levine. I don't know if you've come across the Scientific Basis of Dental Health document. Ronnie is one of the key authors of that document. Then moving round, we've got Dr. Jenny Godson. Jenny is actually one of the regional leaders for the service side of dental public health here in the Yorkshire region, and is very influential on the national field in dental public health. We've met Claire Hume already. Then we have, this is Swanjit Shahid, who again works within the community dental service, so working the public health service side. These people bring very practical aspects of the teaching, so they really know exactly what they're talking about in terms of applying the theory. Then we have Mr. Shahid. This is a general dental practitioner who has trained and is qualified as a consultant in dental public health. So he brings a particular focus about primary dental care. We have Vidya Venkatesh, very popular with our students. Vidya is currently a trainee in dental public health and teaches on some of the course. Then we have John Beale. John is renowned worldwide for his expertise in water fluoridation and other preventive approaches to dental caries. And then finally in this little group, we've got Diane Seymour. Now, Diane has prepared a very short welcome video. I'm going to open it up for you now. If you click on play, you'll be able to hear Diane welcome you to the course. Hopefully that worked for you. All of the staff here are very supportive and welcoming, and we do have a small number of staff that come from other parts of the world that are ready to drop into training at any point and give us some insight into international dental public health. Up here on the top we have Wendell Evans, who is an international expert in dental public health based in Australia. We have the very lovely Alessandro Villa from Milan in Italy, who has expertise in oral cancer registries in particular. And my Viking friend here is Bettina Anderson, who is a dental hygienist by background and works within the health system in Denmark, which is a fascinating system, who look after their patients and population very beautifully. So we have a lot to learn from them. So now that the staff have all welcomed you, with their pictures at least, I'm going to very briefly cover what are the modules that you'll learn in dental public health here in Leeds. This pyramid here gives you a very brief indication of the sorts of things that we're going to do. In the bottom tier here, there are 4 modules, and these are the modules that you're going to study along with the other dental students who are studying master's degrees. So the masters in paediatric dentistry, orthodontics, restorative, implantology, as well as your group of dental public health. These lessons take place mostly within the first 2 weeks of the course. So it's quite intense when you first start. You're going to learn about the introduction to research methods and ethics, statistics, and then the core epidemiology will run through the seminar a little bit longer. The class sizes for this are in the order of about 30 students, and all of them at this point will have a dental background, but you'll be working with people from lots of different areas. At the same time, you're going to start some courses with the International Masters in Public Health course, the MPH. There are 3 modules that you do with this group, and our alumni are going to tell you a lot more about their backgrounds and the real benefits of working with people from a much wider perspective than dentistry. I think this is one of the real benefits and key aspects of our course, is the integration with people from many other countries and backgrounds. And then finally, as quite a small group, you're going to work with us here at the dental school on the dental public health aspects. So there's 1 module, the Principles of Dental Public Health, and that really runs throughout most of the year. So we see lots of you over a long period of time. And we also look after you for your research project. Our current students might mention their projects, but we're very excited about the quality and depth of research that we conduct here at Leeds. And we give something to the community with our research also. So we're very proud of that, and we would welcome you to join us and to help contribute that way. Now, finally, I want to speak to you about what does dental public health mean. I'm not going to give you a definition because we'll do that when you arrive, but really we feel that dental public health is about giving the bigger picture. It's not just about oral health, but how that fits within general health and making our populations healthy and happy. One of the things we hope you go home with when you've been on the course with us is an awareness of inequalities, how to measure them, how to monitor them, and how to improve stopping the gap in inequalities. There are also inequalities in terms of access to healthcare, not just dentistry, but wider than that, and we'll talk about that in the course. And one of the things that we do here in the UK working within dental public health as a consultant or a specialist is to act as what we call an honest broker. We're the people that hold the big picture about services and look after the views of what's important for the population itself. So we try to act between the commissioners and those providing services to make sure the population gets the best value for money and the best experience of health services. We also tend to know quite a lot about the evidence base for dentistry, and in particular prevention. So you're going to learn a lot about that on the course and go home as a real expert in hoping to make differences to oral health. So finally from us, I just wanted to know, what's dental public health to you? There's a little voting section just popped up for you now. Some of the answers are just for fun. I'd really like to know, why have you chosen dental public health at Leeds to study? So if you would kindly vote now and let us know. This helps us actually know what we're going to help you with when you're here and preparing you for your career afterwards. Okay, so I'm seeing that the majority of people are hoping it's going to prepare you for a teaching position. That's fantastic. To bring you to Leeds and to give you these skills to take back to a teaching position will be our great pleasure. Now, my biggest pleasure is going to pass you over now to our current students, our alumni. We're very, very proud of them. They're doing a fabulous job here with their studies, and they've very kindly given some of their time to help share their experiences to help you prepare for coming to Leeds. So I'll speak to you at the end again, but thank you for joining us, and I'll pass you over to the students now.
The current cohort of dental public health students, and we're just going to introduce ourselves. I'm Jenny Owen, and I'm a hygienist and therapist in the UK, and I work here at the University of Leeds with hygiene and therapy students.
I am Jean-Marie Richemont. I'm a dentist from Haiti. I've been working in the hospital and community dentistry.
Hi, I'm Hanan Omran from Libya. I've been work like a teacher assistant at the University of Tripoli.
I'm Yukimura from Japan. I'm a dentist. I was working in a public practices and nursing homes and home visits for the elderly.
These are our email addresses, and we are very happy for anybody that wants to email us either today or after today when you think of any questions. So we're happy for any questions to come to us. First of all, I just wanted to talk to you a little bit about the lecturers that we have with the Dental Public Health and the Master of Public Health International course. All the lecturers are really helpful, and they're very approachable, and they're really experts in their field. They work within the field that they're teaching about, so they've got a lot of practical experience. And I think you saw some photos earlier that Gail showed you from the majority of the Dental Public Health ones. The majority of the Master of Public Health tutors work internationally as well, so sometimes they're in the UK and sometimes they're working abroad as well. We found that doing this course has been really useful in that there's face-to-face lectures, so it really helps to understand and develop what it is you're learning about. If there's any confusion, I think you can discuss it within the group, so we found that was a really big bonus for us. This is a picture of some of the international students when we went on a trip to Wakefield, which is in a town not far from here, to find out about the strategies of public health that they have in Wakefield. So that's some of the students that we have there, and there are students from Nigeria, India, Sudan, Japan, Malawi, so there's a vast array of students. The picture that you're seeing now is Reinhardt. He is the programme director for the MPH course, and he works alongside Mariam Barbrake, and they work together, and they sort of mainly are the two main people that you'll come across for the Master of Public Health course, but there's about 5 or 6 other lecturers that you'll also see, and again they're all really lovely and approachable. We found that working with the international students was really helpful to us because they've all worked in different fields, and so it may be TB or HIV, and they've worked quite a lot of experience they bring with them. So when we're working in groups and presentations and things, it really helps us to learn from them, because I certainly hadn't come across anything about HIV or TB or malaria, so that was really useful for us. And there's a picture there of some of the students doing a group work. So we've got students from Kenya, Haiti, India, and Singapore there. The international group tend to do quite a lot of social events. They organise sort of structured ones that the staff organise. So things like they had a couple of days where you go in your national dress from your country. So everyone would go to the event in the evening. And they also did a session where you cook a dish, a traditional dish from your country, and take it along, and everyone tried everyone else's food. So that was nice. And there's also several other class gatherings, whether they be formal ones that the staff organised or ones that students organised themselves, and trips out as well around the UK. And that's just one of the pictures from one of the earlier social events that we had.
Okay, why I chose Leeds University is one of my friends in the UK, she recommended me Leeds cities, and it's really true. Leeds is not too small, not too big, easy to walk around, and easy to access to excellent public transport. And also the university has lots of social events, cultural events, community social clubs. And also I strongly recommend university accommodation, especially for postgraduate students. It's really quiet and it's the best place to study.
Yeah. Also, Leeds, it's in the heart of the UK, and it has excellent transport, so which linking to New York, Manchester, and London and Liverpool. It has the airport and the train station and the coach, so you can traveling around the UK with using this accessibility. And the Leeds University, it's closer to the city center, so you can go to the city center and reach every place. It's too easy, and it's safe and multicultural. The people, it's accepted different people from the different religion, and the people, it is the people very friendly, and the city, it is very exciting city to the visit, and you can find different shoppers from different countries.
For me, I chose the University of Leeds because when I Googled a university I wanted to study to, Leeds come up with like the city with the most international student community. And then I knew that leaving home, leaving my family, I want to go somewhere that I feel comfortable with other people who live their house, and then we can bond and socialize together. And I read reviews about other students who had experience in the University of Leeds, and then they really liked the experience here. And from the time I applied to the university, I had great support from the staff, asking me every time how things are going. And then from this, I knew that I would be comfortable in the University of Leeds.
About the Leeds University, there is a language center in the Leeds University, which it is useful for all the students, especially who are coming from the different schools with different rules. It is helped to improve the level of the academic language, academic English, to meet the university requirement, improve the reading, writing, and listening and speaking. This give a practice for writing assignment, conducting research, and discussing with the other peoples, and how to conduct the seminar, everything about the UK schools and the UK regime in the schools. There is only one course it is available for years. It is 6-week summer course, which the deadline in the 26th of June. So there is time to apply for this. It's really useful for the student who applying for the master or the PhD student. This course, it is only 1 year course, so you have to think. I've got some hints and tips before coming. This only 1 year's course, so the time management, it's too useful. Like what I said, it's the professional course is preparing for the master, so preparing you how to manage your time, how to get the assignment before the deadline and everything. And I recommended thinking about the dissertation, the plan for the dissertation, like the idea about the dissertation, the dissertation, and do some reading about the statistic, because have a module about statistic and about the dental public health and public health in general. It's more useful before coming.
I still have more hints and tips for you. If you guys can sort out your accommodation before you come, it will be very useful, because when you get here, the accommodation is a big deal, because as Yuko said, the university accommodation will be the best for you. And then plenty of time before the courses start, because the courses are given in different locations, and then you need to know the locations before the courses start.
Also, if you open a bank account or extending visa after coming here, I recommend you to make sure if you have enough time to prepare, and also make sure the procedure before coming here.
So we just put together a few slides that might help you think about how we're going to use this qualification when we finish and complete it. I would personally like to become more involved in research and do possibly some further study in the future. I'd also like to alter my current role within the university so that I can do more teaching in dental public health and the areas of research.
Actually, from that course, I gained a lot of knowledge about the dental public health and the public health in general. It will be help me in my future work, especially when I'm come back to my country.
Okay, I may be working in dental clinic and working for the elderly, and but also there are a number of doors will be open for me after this program. I may be working in public health sectors, or I may be working overseas.
For me, I think I have a lot of knowledge now in public health in general, and in dental public health, because one of the reasons I chose to do dental public health was because I wanted to have a greater impact in the field of dental public health in my country. I look forward to work with the dental health authority in my country to improve the dental health in my country. Thank you.
Lovely. That was, that was really helpful. Thank you so much for preparing that. One of our guests has asked a question about, is there a bank that is better or easier for international students to register with? Do you have any advice?
Yeah, it is too easy. Just you coming with the visa, and you are with the offer from the university and your address. At least you have the address. It is easy. Go to any bank, and it's only about 1 day to apply. It's half an hour, and after that, just waiting a while, about 2 days or 3 days, and the bank account is open.
Okay, which one did you use, Hannah?
I use TPC.
TPC. Okay. So it sounds like any bank will be very helpful. Our banks around about the university in particular are very used to having new students come and visit with us.
Yeah,
so,
and also there is an Islamic account. If there is any Muslim people, there is an Islamic account for in the bank. So just asking about the Islamic account.
So that's really helpful. Thank you. Okay, so we're going to finish up now with any questions that haven't been answered that you would like to ask us just now. Do feel free to get in touch with us afterwards if there's anything that we can help you with. And I'm just waiting on any questions, but while we are, I'd just like to say thank you very much for joining us this afternoon, and we are very much looking forward to welcoming you to our family of dental public health here in Leeds. So we've got a question about how do you have to choose professors before the course starts? You're very lucky that you just have us all. So when you choose your project for your research, then naturally one or other of us will be more involved in your research project depending on the topic. but we'll help you to choose, and we'll also give you some ideas about which projects you could do within the year. Any other questions? You are very welcome. Okay, so if there are no further questions, we will let you go and enjoy the rest of your afternoon. Oh, perhaps one more question coming. You're all very, very welcome. Enjoy the rest of your afternoon or evening or morning, depending on where you are in the world. And take care, and we shall speak to you again very soon. Thank you.